welcome to Let's Talk with Mariama, your channel of motivation, inspiration, and positive vibes. So today we're going to talk about physiotherapy. What is physiotherapy? What do you need to do to be a physiotherapist? What could you do after studying physiotherapy? What do physiotherapists treat at all? I know most people would think, physiotherapy, it's all about massage and all that, and people have no idea what physiotherapy is all about. And I've been getting emails from viewers asking, what is physiotherapy? Your previous videos are very interesting and we would like to know a bit more. That's why I am doing this video. So what is physiotherapy? Well, physiotherapy is a branch of health professions, and where we actually restore functionality, movement after illnesses, injuries, or disabilities and all that. So with physiotherapy, we go to the university. It's a 4-year program, and there are certain universities that actually study it in 3 years. But my program, where I did my physiotherapy studies, the bachelor degree in Cuba, and in Cuba all the bachelor degrees are 5 years and plus 1 year of language, Spanish. So it took me 6 years to actually get my degree in physiotherapy. And then I did my master's in Switzerland. That was 3 years, and other universities would do it in 2 years, and also it depends where you're studying it. But I will do another video on that specifically, but we're going to get into what we do as physiotherapists. When patients are referred to us, we have different possibilities. You have direct access, where patients could just go directly to the physiotherapist and then, lay their complaints and then get the service. And you get other systems where you have to be referred by your doctor to a physiotherapist in order to get the treatment. So when you are referred, or when you get to a physiotherapist, we do the assessment at first, and then we diagnose the case. We set a treatment plan that is adequate for whatever diagnosis that we have, and then we do the physical treatment. And then the physical treatment comprises of different things. It would be training, it would be muscle manipulation, it could be physical agents, it could be electrotherapy, it could be several things. But we'll be talking about all these things in detail, because I'm gonna do like a series of health issues that we treat in physiotherapy. And then we also do a lot of patient education, as in we talk to patients about what they have, what they could do to reduce the risks, or what they could do at home in order to get better if they cannot come often and stuff like that. So for them to be informed about what they really have and how they can manage it at home, or how they can actually deal with the situation. We also promote health in different ways, as in health promotion it could be in groups, it could be individually and all that. So physiotherapists kind of like do a lot of things. And you'll be asking, where would I walk, or where could I walk, or where could I practice my career as a physiotherapist? Physiotherapists we can practice it in almost everywhere in the health service. You can work in a hospital as a physiotherapist. You can work in a health center, in a clinic, in a sports team, in the medical team. You can also work in nursing home and all that. So you can do a lot. You could do home visits. And then the other thing is, what do we treat in physiotherapy, or when can you use physiotherapy? It is amazing, because before I studied physiotherapy, I had no idea what physiotherapy was all about. I thought it was massage, just like everybody else, but I was very wrong. It's an intensive allied health sciences. We work with different patients. We're very, very diverse. That's what I love about it. We work with basically all medical cases. and specifically neurology patients like stroke patients, multiple sclerosis, Parkinson, etc., just to mention few. And we also work with cardiology patients, like after a heart attack and all that, improve the functionality of the heart as well. And we also work with pulmonary patients, that would be like the lung patients with cystic fibrosis, COPD and all that. And we also work with gynecological patients, as in pelvic floor patients, incontinences or leakage, or pelvic organ prolapses and all that. And we also work with children, that will be pediatrics, with cerebral palsy children, with brachial palsy and all that. And then of course the famous musculoskeletal patients, like sports cases, sport injuries, back pain, knee pain, shoulder pain, post-operative cases as well, in surgery cases, to improve the mobility, to improve the strength and muscle power and all that. So in physiotherapy, it is super broad. That's what I like about it. And within all these specialities, we have actually a list of specialities that you could actually study in physiotherapy, which is quite amazing. I will be doing a video about that, but until then, this is what physios do. We're very flexible. We relate a lot with our patients, because our patients don't just come and you get a prescription and you're gone. Patients are with us for a very long time. It could be weeks, it could be months, it could be years. And so you kind of like at some point tend to get to a personal level with your patients. It's not anymore a number or patient X. They become part of you. They become, some of them become your friends or family and stuff like that, and which I really do appreciate, because knowing that I love working with people, getting this contact and all that, physio has given me actually this possibility in my daily professional life to also connect, to relate, to associate with people from different walks of life, different characters, different problems, and every single person that leaves and then other one comes, your mindset has to change, because it's a different person. Your approach has to change, and this flexibility is super amazing. I love it about physiotherapy. So if I have not answered your question about what physiotherapy is all about, you can still send me a message, or you can comment down below, and then the next video will be talking about physiotherapy but in a different way. But until then, I would like you all to have a great weekend, and then thank you for watching. If you have not subscribed yet to the channel, this would be the time for you to subscribe, like the video, and comment and ask your questions, and I'll be glad to do a video on them. Goodbye.